This is one of the most common mistakes or misunderstandings in our industry today. What is the difference between home care and home health? I'm Kevin Daniel, owner and director of Visiting Angels of Charlotte, and today we're going to talk about the difference between home care and home health. There is a lot of confusion surrounding this topic when it comes to the differences between home care and home health. I can tell you this, they are not the same thing. There are a few key aspects which separate these two topics. Number one is service. Home health services are carried out by licensed medical professionals. For instance, skilled nurses, physical therapists, occupational therapists, speech therapists. These are all licensed professionals. These licensed professionals must carry on tasks which are prescribed by a licensed physician or nurse practitioner or physician's assistant. On the other hand, home care services are completely non-medical. In other words, there is no prescription needed for any of the services that we provide, such as personal care assistance, light housekeeping, laundry, transportation services. We help with personal care such as bathing, dressing, grooming. We also do homemaker services such as cleaning up around the home, helping take care of maybe your dog or your cat if you have one. So these are one of the key differences between home care and home health. One is medical, one is non-medical. Number two is payment. Home health care is paid through either private insurance, Medicaid, or Medicare. Home care services are not paid through any of these insurance routes. In fact, most of home care is private pay services. You may be able to get reimbursed through the VA if you're a veteran or a spouse of a veteran, and you also may be able to get reimbursed if you have long-term care insurance. Number three, consistency. Home health care is usually prescribed for 1 to 3 days a week. The visits will usually last no more than 30 minutes per visit. Also, the consistency of the caretakers is nowhere near the same consistency as home care. In other words, you will most likely get a different caregiver each day of the week with home health. With home care, our primary focus is consistency. We want you to have the same caregiver each day of the week. We also allow on the first week a couple of different caregivers to come in just so you can let us know who your favorite is. Our goal is to provide consistency in home care. Number four, hours. As mentioned previously, home health, the most you will be getting in a visit it will be 30 minutes. And that's mostly from a certified nursing assistant when they come in to provide a bath 3 times a week. Other visits from nurses will usually last about 15 minutes. When you have physical therapy or occupational therapy services, those visits are 30 minutes as well. Home care, we require, if you live at home, a minimum of 4 hours a day. But we can provide care up to 24 hours per day. Here at Visiting Angels, we have a minimum of 4 hours per visit for any of our clients who live at home. But we can provide care up to 24 hours per day. In different communities such as independent living and assisted living, we're a little more flexible, where we can come in and provide care a minimum of 1 hour per day. Oftentimes, home health just cannot provide the care when your loved ones need it most. For example, a lot of times your loved ones may have dementia and be roaming at night. Our caregivers can provide care overnight shifts, during the day, anytime you may need it. Home health does not provide overnight care for the majority of their patients. If you'd like to learn more about working with Visiting Angels and all of the great services that we provide, please visit our website, visitingangels.com/scharlotte, or give us a call, 704-841-1160.